Hi, this is Dr. Tiffany Jackson, naturopathic doctor at Natural Medicine Now University. Thank you for joining us for this webinar, Understanding Men's Health and Hormones. Hormones play a big role in men's health, affecting energy levels, weight, mood, libido, and much more. Men are not immune to the turndown of hormone levels with age. In fact, testosterone starts to decline in a man around their mid-40s, depending on their lifestyle and their stress levels. But unlike the roller coaster effect that goes on with menopausal women, male symptoms come on more gradually, and most men are not aware of what has hit them. So in this webinar, I've invited a special guest, Dr. Kurt Wohler, to teach you about the importance of male hormones, prostate health, and natural solutions to keep your testosterone levels optimized. So let's get started.
All right. Well, welcome, Dr. Wohler. Thank you so much for being here for this webinar, Understanding Men's Health and Hormones. How are you?
I'm doing great. I'm glad to be here. Thank you.
Well, let's go ahead and just get started. What do you think are the most important male hormones?
Oh, gosh. There's the two primary ones. I mean, the main one would be testosterone, would be really the most important hormone from sex hormone, particularly from a male standpoint. And then second to that would be DHEA, which is part of the adrenal system. And with the importance of DHEA is it actually is a feeding hormone for testosterone. And there are a lot of other hormones within the endocrine system, but testosterone and DHEA would really top the list for men.
So what about estrogen in men?
Well, estrogen is important. I mean, it's all of it is important, of course. I mean, estrogen is going to be the primary thing that you would think about with respects to women, but testosterone is also important in women. Certainly, the reality is that there needs to be a balance of these hormones. It's not all about testosterone. It's not all about DHEA in men. There certainly needs to be an adequate production of estrogen and even progesterone. Men produce progesterone as well. Progesterone, for example, is important for sleep. And so if people and men don't get enough progesterone production in the evening time, that can inhibit their ability to get adequate sleep. So it's really about the balance of hormones. But in men, obviously, the body is moving towards a greater percentage of testosterone and DHEA. But yeah, the balance is critically important.
So what kind of role do the adrenal glands have on male hormones?
Well, the adrenals, as we've discussed before in other webinars, have an impact on every organ system in the body. And when you're talking specifically about male hormones, you're talking about the balance of two types of things. One is called pregnenolone, and the other is DHEA. Now, DHEA is necessary because it is a feeding hormone to produce testosterone as well as estrogen. It just so happens that in men, you're getting a greater percentage of DHEA being converted into testosterone versus estrogen, and the opposite in women. Pregnenolone is part of the adrenal system as well. It's a little higher up on the food chain, if you will, and it has a responsibility for producing DHEA as well as maintaining a balance of things like progesterone, aldosterone, and most specifically cortisol. So when we're talking about adrenal function, and for example, I do a lot of salivary adrenal testing in patients, we're really looking about the balance between cortisol and DHEA to get an idea of how well that entire hormonal system is balanced, if you will, or out of balance. So the adrenals are critically important when you're discussing anything from the endocrine system, both in men and women.
So when we're talking about hormones and hormone balance, can you just take a minute to discuss, when men are younger, they have more vibrant sex drives and feeling or better energy. And then so what happens as we get older and age with these hormone levels and testosterone levels?
All of us are going to age. I mean, that's just the way it is. That's just nature. So it's not as though these levels are going to stay at the level of a 22-year-old forever. Now, you can try and supplement for them, but the body's still going to age just as a natural process of life. But what happens with a lot of people is they go through a stage or stages of premature aging based on chronic stress, whether it's chronic stress from a mental emotional standpoint, lifestyle factors, diet, environmental factors that have an impact on the adrenals, which then have an impact on the ovaries in women and then the testicular production of these hormones in men. When we're younger, obviously, the body is developing and growing, and we're outputting these hormones in a tremendous, significant degree. And as we age, there is a natural decline that will happen. In most, I guess you'd say most non-modern cultures, or, we look at the type of stress we have here in the United States, unfortunately, the other lifestyle factors take a toll. So what the goal of any health program is to try to optimize health, and that is getting adequate sleep, eating a healthy diet, getting adequate exercise to maintain a normal balance of these hormones throughout life, with the understanding that there is going to be a natural decline, but there shouldn't be these rapid drops or significant declines that happen with many people that we see in our practice today in their early 30s and their early 40s, where they're starting to manifest with sex hormone deficits of an 80-year-old. I mean, that is not normal. And those are some things that we can talk about from a lifestyle standpoint. So, yeah, there is a natural production of these things as we're younger, but we should be able to maintain these hormones to an adequate degree as we age if everything else is in balance in our body.
Well, I heard you say sleep as part of a lifestyle factor, and I know some people, they're just thinking, oh, sleep, whatever, I only get 4 hours, 6 hours, I never get a good night's sleep. Sleep is such a vital part of being healthy and keeping things in balance. So I know I've heard you lecture before, and I just want to hear you tell our listeners how important sleep is for their hormones.
It is one of the most important things that we can do. I mean, sleep is absolutely necessary for the regeneration and the psychic healing, if you will, of our nervous system. But it also is an opportunity for our body to be repaired. What happens is when we are asleep in the middle of the night, we get a production of growth hormone. Nowadays, we have people who are wanting to take growth hormone to get bigger and to feel younger, but we get growth hormone release through the middle of the night as a way to repair our body. And so sleep is critically important. Matter of fact, you can come up with the greatest supplement program, you can make changes in your diet, you can exercise, but if you're not getting good sleep, you're absolutely sabotaging your health program. It is absolutely critical to regenerate and repair the damage that has been done or the stress that has been done on a daily basis. Just by living your life, we have to get sleep in order to repair the nervous system, repair the muscle tissues, repair the bones and the joints. I can't speak enough about it. I mean, there's books, there's scientific literature, there's entire seminars on the aspect of the importance of sleep. So, unfortunately, we live in a busy culture anymore, and people have access to their computers and television, and they're not getting adequate sleep. And it's one of the main reasons that people just are not healthy anymore.
I'll go ahead and just mention one of my favorite books that I get patients to read is called Lights Out. It really goes into just what's going on in our culture and how we're out of our natural rhythms and all the artificial lights and, how it throws our whole body off, including the hormone and, growth hormone and all of our hormones to be healthy. Well, let's get back to just, the importance of men. Here, we're talking during this webinar about understanding men's health and hormones. So let's get back to testosterone because that's really what most men identify or used to identify as their main male hormone. So now you've told us there's other hormones involved. They do need estrogen. They do need DHEA. They do need pregnenolone. Let's talk about how can people use natural nutrients to boost their testosterone levels and other hormones to keep them in balance.
One thing I want to mention is it's not as though men are going out and taking estrogen or men are specifically going out and taking progesterone. If men work on the core aspect of their health, adequate sleep, eating a whole food diet, staying away from the refined carbohydrates and the trans fats, incorporating more fruits and vegetables and healthy meats, fish, for example, and taking a variety of different supplements to support their underlying health and also their adrenal function, their progesterone, their estrogen, in many respects, their testosterone levels will normalize. Now, in some cases, they might need supplemental DHE and testosterone to get the levels up to a more optimal level, but the body wants to work well. The body wants to be in balance, and through lifestyle factors, it gets out of balance. For example, if men tend to have a reduction in their testosterone through lifestyle factors, through adrenal stress, oftentimes what happens is they get an imbalance of estrogen to testosterone, where there's more of an estrogen dominant effect in men. And that could be a problem because when you get an increase in hormones, for example, and let's take in men, if you get an increase in estrogen, what can happen is the body produces something called sex hormone binding globulin. It's a protein that basically binds up other hormones. Well, what's one of the other hormones that it's going to bind up? It's going to start to bind up extra testosterone and rendering that available testosterone useless, if you will. The other thing that can happen is, increased estrogens can stimulate the prostate. We can talk about that. Increases belly fat and gynecomastia, where you start to get breast formation in men. The one thing we haven't mentioned is the blood sugar imbalances that people have when they have hormonal imbalances. When people are being driven towards the caffeine and the stimulants and the high carbohydrate foods, that creates a lot of blood sugar imbalances. And that creates a hormone imbalance as well, further causing stress on the adrenals, further causing stress on the sex hormones. So it all plays, into this whole aspect of lifestyle. Incorporating a healthy diet, for example, zinc. Zinc is critically important in the hormonal system. Particularly, it helps in the maintenance of a healthy prostate. We know that prostate disease is a significant concern for many men. And also, you need adequate amounts of zinc to produce adequate amounts of testosterone. I've already mentioned DHEA as a hormone that's needed. Matter of fact, for years, DHEA has been talked about as an anti-aging hormone. But as our adrenals start to falter and as our stress starts to increase, our DHEA can start to be problematic as well. Essential fatty acids. I mean, I know, Tiffany, as you as a doc, talk a lot about essential fatty acids, these omega-3, the balance between omega-3 and omega-6, things that you might get through fish or, fish oil supplements are critically important to maintaining a healthy level of hormone stimulus through the body as well. So hopefully that helps some people understand the importance of lifestyle and diet in really trying to bring more balance, to how their body functions.
Yeah, that was great. One thing I usually get a lot of my men to do is to supplement also with nettle root, because the lignans in the nettle root extract, it can prevent the binding of the sex hormone binding globulin to testosterone. So this is going to ensure that there's a lot of free testosterone available, which will help promote the male vitality and that youthful sexual function that most men really desire.
Well, another thing too, and that brings up a good point, is antioxidants. So, the foods and the vitamins and the nutrients that are having a high antioxidant quality. Vitamin A, for example, and vitamin E. I already mentioned zinc as a mineral. Another mineral is selenium. All of those things are necessary to produce healthy levels of testosterone and maintain healthy levels of testosterone. And you get those things either through supplementation, but you also get them through your food. And this is where the importance of having a whole food diet is critically important as part of an optimal wellness program.
So do you recommend men have certain blood work to test for these hormones to see if they're in balance? And what age would you recommend that they do this? What are your recommendations on that?
Well, age really is determined upon what kind of symptoms they're having. And you could have, I've had 20-year-olds who, are, incredibly fatigued and have a lot of, issues going on from a health standpoint. So I don't really look at it as age so much. It's how they're doing overall and what kind of goals they have and what are some of the health complications that they may be currently suffering. Testing is essential. You can get blood testing. You can do things like testosterone and total testosterone and free testosterone through the blood. You can look at something called androstenedione, which is part of the sex hormone system with regards to testosterone production. Certainly look at DHEA levels in men as well. But honestly, blood testing is great as a baseline. I don't find it to be all that useful in some cases for if you're having to replace or do, hormone replacement therapy. Another option for people is salivary testing. The benefits of saliva hormone testing is that you actually get what's called the free fraction of hormones, cortisol, DHEA, and you can also look at estrogen, progesterone, testosterone levels as well. And it's a convenient way of assessing these hormones because you can get a full panel based off of a saliva test. And the benefit of that, particularly when you're talking about the adrenal assessment of looking at cortisol levels, is that cortisol is not produced at the same level throughout the day. There's different times of the day where more is produced versus others. And so the saliva test look at 4 different samples over a 24-hour period of time to get a better representation of adrenal function. And then that information can be linked together with what's happening from the sex hormone standpoint. So I really like salivary adrenal testing and saliva testing for hormones and the sex hormones because of a more complete picture.
So let's shift from talking about hormones and talk a little bit about prostate health and function. So what can you tell these men that are listening out there about their prostates and how to keep them healthy?
Well, first off is for people to understand what their prostate is for men to understand that. The prostate and its function primarily is what it does is it secretes a fluid to help sperm survive the acidic environment of a woman's vagina. I mean, that's the basic essence of the prostate gland, is it's creating this alkaline fluid so that it increases the longevity of sperm. The problem is that for many men, it becomes an issue when it becomes enlarged. And so when the prostate becomes enlarged, it starts to impede the flow of urine. And so men can end up having urinary problems because of enlargement of the prostate. And then, of course, in some men, if the prostate becomes enlarged, it's susceptible to inflammation. So prostatitis is a condition where the prostate becomes inflamed. And that certainly is painful and uncomfortable for a lot of men as well. And then, of course, is the issue of prostate cancer. And, the downside, just in women, where the major concern is breast cancer and others. Well, in men, it's prostate cancer is certainly on the rise. And so all of those things are important to recognize from a prostate standpoint. But what are some things that men can do to, in essence, help support a healthy prostate? And I want to state this as not just something that is specific to the prostate, but these things are important for all of health, because you could think of these nutrients as being something that helps with hormonal balance or adrenal balance or cardiovascular function, etc. The number one thing is diet. I mean, the reality is again, getting back to that concept of a whole food diet, eating plenty of vegetables and fruits, and healthy fats and healthy meats, increasing antioxidant levels, vitamin A, vitamin E, healthy levels of zinc and selenium. Those 2 things are critically important for a healthy prostate. And then if men are having prostate issues, sal palmetto, we know, has been around a long time that can help with a healthy prostate. Stinging nettles, green tea as an antioxidant is healthy from an antioxidant standpoint to support prostate function. But again, it kind of gets back to it's not just about the prostate, it's about how do you improve your overall health in improving your overall hormonal system. And doing so, your prostate's going to get supported in the process.
What would you advise for men that have erectile dysfunction?
Same types of things, really. I mean, if there is an erectile dysfunction issue, yes, it may be a medical problem. Okay, so it's important to look at hormone levels. It's important to look at testosterone levels and estrogen levels and progesterone levels. It's also important for men to understand that erectile dysfunction can be linked in some respects to mental emotional stress. So that can be a contributing factor. I've seen men who have erectile dysfunction issues who have a lot of mental, emotional stress in their life. There's a component with depression, anxiety as well. Poor sleep, interestingly enough, fatigue can be a contributing factor to erectile dysfunction. And the reality is that when men are not sleeping well, there's a lot of mental, emotional stress, there's a lot of fatigue, they're usually not eating well. So there tends to be nutrient deficiencies. So a lot of things we talked about with respect to the prostate, or going back talking about adrenals or talking about testosterone, also have an impact on a healthy ability to have an erection. A couple other things: excess alcohol and cigarette smoking. Those two things are directly involved in erectile dysfunction, specifically cigarette smoking. So if a man is having erectile problems and they're a smoker, they absolutely need to get off of cigarettes. I mean, that's just going to be, one of the main issues there. The other thing is, I need men to understand that if erectile dysfunction is occurring, it can be an indicator that there are other things happening within the cardiovascular system, the heart and the blood vessel system throughout the body. Because things that cause a lack of blood flow from the heart standpoint may also be going on and occurring down at the level of the penis, in the ability to get adequate blood to the penis to be able to produce and maintain an erection. So there is a link between cardiovascular illness and erectile dysfunction.
The number one killer of American men is heart disease. So I'm really glad that you pointed that out. And is there anything else, since we're almost here towards the end of the webinar, that you could mention about just heart disease in general and how to protect yourself from heart disease?
Well, one thing is trying to maintain healthy levels of testosterone. It's amazing the research that has been shown in testosterone's positive influence on the cardiovascular system and heart disease. So that's why we talk about testing and lifestyle and working on diet. But it all goes back to, again, this whole discussion about, a whole food diet, cutting out the alcohol, getting rid of the cigarettes, getting exercise, getting good sleep. We have to work on the entire body in order for the entire body to be healthy. It's not just about taking zinc or selenium, or it's not just talking about taking a couple fish oil supplements. It's a whole package. If we feed the body what it needs, if we feed the body what's healthy, our body is geared to become healthy. Our body is always, I believe, trying to move to a position of optimal health. We just have to do the things that our body needs to get there. And so, heart disease, it's no mystery that so many men have heart disease. It's because our society, our culture is so out of balance with respects to poor sleep and excess stress and, poor food. I mean, it's just going to take its toll. This really isn't rocket science. It really is common sense things, and people just need to get back to, doing the simple things that make a big difference. Is exactly what we've been talking about here.
One last question that I frequently get from a lot of my male patients. What do you think about men eating soy?
I'm not a big fan of soy. And, there may be others that might disagree. I'm not a big fan of soy. There's a lot of phytoestrogens in these estrogenic compounds in soy, which can, if you eat a lot of it, may create an imbalance, particularly in men. There's other factors of soy, too. A lot of the soy is very processed. It's hard to digest. And one other thing we haven't talked about here, but for a lot of people who eat a lot of soy, it contains something called oxalates, and this may be a topic for another webinar. But oxalates are these compounds that are a contributing factor to kidney stones, but to a lesser degree, they can form small crystals in the body that rob the body of necessary nutrients, including selenium and including zinc, which we know we need for healthy testosterone and prostate function. So I think things like that in moderation, but personally I'm not a big fan of soy.
Yeah, I mean, I tell my male patients definitely stay away from soy powders and adding soy milk to their smoothies. And, every now and then it's okay, but most all processed foods, we're just over consuming soy, and the fact that it's genetically modified at a level that's the body, it's unheard of for you to get that much in your body. And the body really doesn't know how to process, and it really does mess with the hormones, including women too, not just men. So
yeah, I absolutely agree.
All right, well, we're here at the end of the webinar. What are your 3 action plans that you would like all men that are listening to take?
First, they need to get regular checkups by their doctor. You're looking at particularly getting prostate exams, particularly the older they get. Make sure there's no nodules, make sure it's a healthy size, there's no inflammation. That's important. 2, getting adequate sleep, working on mental emotional stress, and also getting adequate exercise. Cardiovascular exercise, plyometrics, weightlifting, all of those things are important and healthy to improving healthy hormones. And then improving their diet, getting back to a whole food diet, cutting out the alcohol, cutting out the cigarettes, decreasing the stimulants, and getting back to eating fruits and vegetables and healthy meats. All of that is going to make a tremendous difference. And then if they are dealing with these issues, they're not feeling quite as energetic as they were when they were in their 20s, they need to get testing. Okay, so looking at hormone levels, doing adrenal testing, all of that is critically important as a package deal to improve optimal health.
Well, that was such a good overview, and I hope we've enlightened some of our male listeners. So thank you so much for being here.
It was my pleasure. Thanks so much.
Thank you for joining this webinar. I hope you now have a better understanding of male hormones, preventing prostate cancer, and natural solutions and lifestyle factors that will help keep your testosterone levels optimized. So take action and prevent disease. This is Dr. Tiffany Jackson wishing you a happy and healthy day.